Today, I wanted to talk about the medications that I take and the anti-rejection and immunosuppressant medications. Now, I've mentioned this in previous videos that the amount that I started off taking has decreased over time, and it'll probably be the same for a lot of uh, patients that have gotten transplants. The amount of medications that you take initially will decrease over time. Now, each individual case may vary, but I started off taking about 12 to 13 pills in the morning and evening. So as you go along, once you get the transplant and once things settle a bit and you recover a little bit more and your labs settle into what they're going to be moving forward, sometimes those pills will decrease, and sometimes the amount of medications that you take will increase. For me, I started off taking about that many pills, and now I went from that to about 7. So some of the medications that you take, there are timestamps on them. Some of them I had to take for about 3 months, and then once the 3 months was up, I took all of them. Then that's it. I don't have to take them anymore. One in particular was about 6 months. Take it for about 6 months, then it's done, and I don't have to take it anymore. But individual cases may vary. Not every patient takes the same amount of medications, and not every single patient takes the same exact medications. They make their regimens according to the individual patient and how they're taking to the transplant. Sometimes transplants can have an ease of use where they're just like, hey, his labs are looking good. He doesn't necessarily need to take these medications anymore. So after the 3-month period, we can just stop him. Cold turkey. 3 months, he's done. 6 months, he's done. But some patients may require longer regimens because of whatever it is that your transplant team is seeing in your blood work. Because that's how they determine whether or not you can, continue on taking a medication or stop taking a medication. So if you get a transplant, if you end up getting a transplant, the amount of pills that you're taking can seem very intimidating. But just know that after certain periods of time, eventually that number will decrease. And it's important to communicate that with your transplant team. Like, for example, if you're taking a certain medication that has a certain side effect, communicate that with your transplant team and say, hey, listen, this medication that I'm taking, these anti-rejections, antivirals, anti-whatever, immunosuppressants, they're giving me these harsh side effects. What can I do? Is there any alternatives to this? Is there anything that we can do to sort of alleviate the side effects of this, whatever plan they come up with? Because I remember feeling very intimidated. They gave me a lot of different medications to take on a daily basis, both in the morning and the evening, because that's my schedule. So I take my anti-rejection, my antivirals, my anti-everything on a morning and evening schedule. And when you're taking so many pills, it can be very intimidating. Of like, oh my God, how am I going to keep all these pills in check? I got to remember to take all of this stuff. And it can be a daunting task. But just know that number, more often times than not, will decrease over time.